Dr. Elizabeth Stuart from Johns Hopkins University. So it is pleasure to meet you, ma'am. So how is it going?
Wonderful. It's wonderful to be here. Thank you.
I feel so good to welcome you at this session. As you know that like your topic is integrating data for causal inference mental health treatment, right? So how your work emphasizes integrating multiple data sets for causal inference in mental health, right? And what are the biggest challenges in harmonizing heterogeneous data sources in this context?
Yeah, thanks for that question. First, I'll introduce a little the sort of premise. Often we want to combine data sources because they each kind of bring something. So in my example, there's sort of two aspects of that. One is just larger sample sizes, so combining multiple studies in order just to have more data.
Okay.
And then the other is combining randomized trial data, which is generally small but sort of has some nice properties, with like larger non-randomized, say, electronic health record data, which is larger but has some other challenges. One of the main challenges that we've had, though, in trying to bring these data sources together is different measurements. So randomized trials are conducted, often they want to show the effect of some, say, medications on outcomes in a relatively short time frame, so maybe 3 months.
Okay.
And they might measure patient symptoms and sort of want to see, okay, do patient symptoms improve over time for one drug versus another drug. The electronic health records don't have patient symptoms in them really at all.
Right.
Patients often are not coming back within 3 months. And so there we have things more like, well, over 1 year, is someone in the emergency department, or do they get hospitalized for psychiatric reasons? So really the main challenge we've had is just trying to reconcile different measures that each data source has for good reasons, but it makes it hard to sort of bring those together.
Okay, yeah. And how can AI and machine learning help overcome discordance in measures across different data sets?
Yeah, it's a good question. There's sort of two aspects of how we're using AI and machine learning in one case, AI, large language models in another. One is we're using machine learning tools to identify variables that predict how well a treatment will work.
Okay.
And so that's not so much necessarily about multiple data sets, but even just within one data set, you can use machine learning to identify these variables, again, that sort of predict treatment effects. We're also using AI in the electronic health record data. We're using large language models to pull out information from the notes that clinicians write. So the clinician might write a little summary of how a patient is doing, and we can use large language models to sort of extract summary information about symptoms, essentially. So it's a way to get closer to what the trials were measuring in a more automated way, rather than having to do individual kind of case report records.
Right. And mental health treatments often vary widely in effectiveness across patient subgroups, right? How is AI helped to better understand and predict this effect heterogeneity?
Great, yeah, that's a perfect next question after. So I mentioned earlier we're using essentially machine learning methods to identify effect heterogeneity. Traditional ways of doing that would say, oh, we have 2 subgroups and we just want to see is the effect bigger for young people versus old people, sort of pre-specified. Machine learning methods, and in particular there's a newish approach called causal forests. Basically you can sort of give that a whole bunch of covariates and it will identify the ones that seem to drive effect heterogeneity. So it's a more data-driven approach and more flexible. It can sort of find these, not sort of just 2 groups, but maybe a combination of variables or that type of thing.
Okay. And with increasing data availability, how do you see the role of causal inference evolving in real-world mental health treatment decision making?
Great. I'm a big fan of causal inference methods. It's basically all of my research. And so I think they can just be very useful when we want to be very careful about estimating causal effects and sort of really understanding treatment choices, whether it's treatment choices or whether an entity should implement some policy, something where we're trying to make a smart choice about whether to do one thing or another.
Okay. And what advice would you give to researchers aiming to use AI-driven causal inference methods responsibly in pharmaceutical studies?
Great. I think two things come to mind. First is to really understand the data.
Right.
As I mentioned earlier, the data is often very messy. Measures are not the same, and it's really important to sort of be grounded, not sort of just take the data set as it is, but sort of think through who is in the data, who is not in the data, how are things measured, really
Right.
understand that.
Okay.
And then the second piece I would say is sort of that causal piece where often in machine learning AI, there's a focus on prediction. In causal inference, it's a slightly more nuanced prediction because we want to learn about causal effects, but we don't actually ever observe a causal effect. We observe some outcomes under one treatment for some people, outcomes under another treatment for other people. So we have to be a little bit more nuanced about measures of model performance and that sort of thing, because it's not a sort of straightforward prediction problem.
Okay. Okay. And how do you think these methods can be generalized to other therapeutic areas beyond mental health?
So this is why I love working as a statistician, is that
Okay.
they're very easy to apply.
Okay.
Most of my work is in
It's
mental
a piece
health.
of cake.
Exactly.
Right.
So kind of the fundamental methods are the same.
Okay.
Again, you'd want to bring in the substantive knowledge to think through which variables to use and how to measure them or what's in the data set. But really, the tools themselves are very, very general.
Okay, so thank you so much for your patience, and it was the discussion was quite insightful, and thank you so much for your time, ma'am. So
Thank
it's
you.
a pleasure meeting you.
Great to meet
Yeah,
you too. It's been
thank you.
wonderful to be
Thank
here.
you. Yeah.